This is also some good information for you to know here this morning. A new COVID variant is surging, especially in the South and the West, and it comes as the FDA recommends COVID vaccines should only be taken by Americans over 65 or with underlying health conditions. I'm now joined by Dr. Abisola Olulade with Sharp Rees-Stealy Medical Group to discuss the latest news making headlines. There's been a lot of news, a lot of health news lately, especially when it comes to COVID and vaccines and everything. So why don't you break down the FDA approvals right now for the COVID shots? Who should take it, who's being recommended, and your thoughts on some of the developments coming out of DC?
Yeah, so essentially they're saying that it should be restricted only to people, just like you said, that are 65 and older, and also people 6 months to 64 years of age that have pre-existing conditions. And this is completely unprecedented. Throughout the pandemic, the recommendations of the medical groups have aligned with those of the CDC and the FDA, and now we're seeing this split that's happening, and that's so confusing for people.
Yeah. Well, what do you recommend professionally for people to avoid getting COVID here as we've seen some of the numbers tick up?
Well, you can take a lot of precautions that we know are widely available. So you can wear a mask, especially if you're immunocompromised, wash your hands, all of those things help. But for example, what the American Academy of Pediatricians, that's the pediatricians group, is saying is that these vaccines are safe and effective. And even the FDA in their memo where they were revoking the authorization have said, we're not doing this because they are unsafe. We're just doing it because the risk is lower. We're not in the same place. But the AAP is saying, well, kids are still being hospitalized. So 50% of children that are hospitalized don't actually have any underlying or pre-existing conditions. And that, of course, is a very big concern. And that's why you're seeing these different recommendations. They're recommending that a different age group, 6 months to 23 months, get this because they are at high risk.
You mentioned high risk. What are some of the high risk conditions that people have?
So this is actually a really good question because it brings up a point that people may not realize that things like obesity, being overweight actually put you at high risk if you're physically inactive. The things that we expect like heart disease, high blood pressure, stroke, diabetes, all of those things put you at risk. But all of this can really create barriers and create confusion for people, very unfortunately.
If someone does not have pre-existing conditions, they're under that 65, they really want to get the shot because maybe they've had it before and they feel like it works for them. What do they have to do? There's some like holes they've got to jump through here now, right?
Sure, yeah. So there are no clear guidelines. So people have suggested that it can be given by doctors on an off-label basis. So something called an off-label basis, which is where doctors can recommend medications that can help you even though they're not FDA approved. But we have to wait to see what the CDC recommends, the ACIP, who recommends typically what the vaccine schedule should be based on the FDA's recommendations. They're supposed to be meeting this month. It's a little late because we're already in the season, so we'll have to see what they recommend.
What's the latest on the variant that's prevalent out there right now?
So it is spreading. It's contagious, possibly more contagious, and it's not been found to be causing a higher risk of death necessarily, but we have to remember that less people getting vaccinated may mean that we may see this change just overall.
We talked a little bit about the southwest parts of the other country. San Diego County, how bad is it now, and what can people do here locally?
Yeah, so the last report that they released was in August, so there's a bit of a delay, and this is just not limited to San Diego, this is just overall, but we're seeing cases go up, we're seeing hospitalizations go up. We expect that for this time of year. We'll see what happens as we move into the winter. We expect that cases, of course, will go up because that's what we typically see.
If they want to learn more, is there a website they can go to?
So go to sharp.com if you have any questions about the vaccines, if you get sick and you need a virtual urgent care appointment, any of that, so go to sharp.com.
Awesome. Thanks for the advice. Really appreciate it, Dr. Abby. Taking a quick break. We'll be right back with your top headlines and your updated forecast.